Well, medical professionalism to me means that we can rely on medical professionals to do what is best for the patient. It also means that we can trust them. I think probably to me the word trust is really important. It conveys not just that patients want to have trust in their physicians, which I believe they do, but also it means that the profession itself focuses on that trust and does everything it can as it regulates itself, as it monitors itself, to ensure that that trust is well placed.
Part of the professional contract that we physicians make with society is, in fact, to be as transparent and as accountable for our decisions and the work that we do as is possible within the confidentiality of an individual physician-patient relationship. So that means that we need to really work and strive for overall improvement of the healthcare system, as well as constantly striving to improve our own competence in whatever field we're practicing.
There's a lot of things that are involved in creating trust, in being a professional, and sometimes those things are in conflict, and that's okay. We can't eliminate conflict, but we need to really work towards not just managing it, but harnessing it and working it out. My generation of clinicians was trained to really shut out the conflict, or the values that are around serving a greater population, and hone in on the values that serve an individual trusting physician-patient relationship. And I think when the resources were more plentiful, that was easier to do. But when you get into a constrained resource environment that I think we're in, and we've all gotten ourselves there, you then have to start thinking about, well, who am I beholden to, and how do I balance the tension between the needs, which might be completely divergent, but are both really important to consider.
Patients trust you to help them. As a physician, that's our most important role, and that is our profession, and that is our professionalism. We have entered a covenant, we have entered a bond, we have entered a relationship that is unlike any other profession. And as a physician, for me, that is my guiding light. That is the thing that I think of most whenever I see a patient, is this patient has put her or his trust in me. And there are many times you're tempted to do shortcuts. There are many times you're tempted to leave when you shouldn't leave. But remembering that that patient has put her or his trust in you is the thing that keeps me there.